The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. So excited to have a heck of a cosmetic dentist on the program today. I'm coming out of California. Dr. Rhonda Kalasho, say hello to everyone.
Hey, everybody. Thank you for having me.
Hey, it's great to have you here. Love it when a dentist comes on the program and shares. Speaking of sharing, why don't you share how you became a dentist? What made you decide to get into dentistry?
I think it dates back to when I was a kid. So I come from like the immigrant story, right? Came from I was born in Baghdad, Iraq, and I came when I was very young, and I didn't have really good dental care. And I remember having a terrible toothache as a kid, one that I couldn't even eat. I couldn't even open my mouth. I went to a pediatric dentist that took our insurance. And then honestly, that day I just felt like immediately relieved. And in the back of my mind, I still had pictures. My mom still carries them of where it says, "What do you want to be when you grow up?" And I was 6 or 7, and I drew a picture of a heart with a cross on it, as if it was like the Red Cross thing, but I put dentist below that, or sometimes doctor. I just knew I wanted to go into medicine. And then when I got into college, I actually was at the time helping my father with his businesses and running those, which were pizza restaurants in San Diego. And then I wanted to then go into business. I went into accounting and business management as my majors. And then I broke a tooth during an accounting final, then led me to an endodontist. And I think that's how the world turns. And here I go again, exploring dentistry all over again. And this endodontist said something very profound. If you want to go into medicine and business, dentistry is the way to go, because dentistry has both medical aspects, but also the small business and business running aspects. It's not just like you're working in a hospital setting or you're W-2, you are a small business owner. And that really gauged my business sense and made me really want to look into that deeper. I did. I shadowed him, and then I took the prereqs, got into UCLA, and here I am. Right when I graduated UCLA, I did a GPR and then owned my practice immediately after residency.
Yeah, that's an awesome story. That's an amazing story. And I've got to tell you, it's pretty rare. It has happened, but it's an anomaly where someone wants to get into dentistry because of the business side of it. I've actually seen a few people that seem to like the business side more than the dentistry, but it is incredibly rare. But as you know, a lot of dentists really struggle with that business side, right? Dentists struggle with it. Physicians struggle with it. I mean, lawyers struggle with it. Highly intelligent professionals really seem to struggle with the business side of it. But this is something that you seem to have tackled. So let me So let me ask you this question: what are some of the business sides of dentistry that you see dentists struggling with that you have some solutions for?
I think it's not understanding finances well enough, like a P&L, something as basic as a profit and loss statement, something as simple as checking maybe your daily accounts aging reports, your overhead. The numbers just go over our heads. We were taught to be clinical minded people, which is one side of the brain, and then you have your creative side. Actually, what dentistry is more left and right brained anyways, but at the same time it delves into a little bit more of the detail of managing and finances, which you have to be knowledgeable of. When I run my practices, I run it based on numbers and percentages. If you ask me how much do you want to charge for so and so procedure, I'll not just spur down a number. I'll have to look at what the overhead cost is of that procedure, who is in charge of running that procedure, how many people do I have to pay to make that procedure happen, how much chair time it is, and then I'll give you a number, because this is how business really works. As opposed to some people, like dentists will say, "I'm just really slow." What I did instead was I gave 50% off all my Invisalign. Okay, but what did that do for you? Did that now get you a very big lab cost, and then now the exchange of your you may be getting more Invisalign cases in, but are you getting more profits out of it? And most of the time that is not true. And so people just kind of run based on gut rather than understanding true business or have true business acumen. So that's a big issue I see.
Yeah, that's a lot to untackle there. With the Invisalign, and you talk about the discounts and Invisalign. I personally think that if you're going to offer discounts in Invisalign, you offer them to people who don't know you to get them to know you so that you can also provide them other services, right? If you're doing Invisalign, someone's going to need a couple of cleanings. They probably have a filling or two that they need, right? There's probably something else that they're going to need, and you have a chance to earn them as a lifetime patient. But if they're already a lifetime patient, when you're discounting Invisalign, you're literally just discounting and you're not gaining anything back. At least you're not gaining a new patient back. Do you agree with that?
Yeah, absolutely, especially with Invisalign. Invisalign is kind of it's a great way of actually luring in new patients to the practice because it's a cherry on top. You can't
Right.
put cavities, you can't put Invisalign on cavities or gum disease or, teeth that need immediate attention. And so when they come in for these consults, you can actually give them a full range of comprehensive treatment and then tell them, it's at the end of all this, then you can do your Invisalign because you don't want to be that dentist who
Right.
is just getting all these Invisalign cases and putting Invisalign on a patient who has active periodontal disease. Lo and behold, a year from now, those teeth are starting to become loose. You definitely don't want to be in malpractice zone. You want to make sure that you're using Invisalign to bring these patients in to increase your new patient numbers or how many new patients you get in a month, but being able to treatment plan them from the perio side all the way to the restorative side, and then using Invisalign as kind of the cherry on top. And that will retain them now as a patient because during their Invisalign course, they should also be seeing you for regular cleanings and follow-up visits. So that is retaining them as your active in your active patient pool, which gives your practice a lot more profitability and it increases its essentially its worth and its value when there's actually
Right.
active patients in your system.
Yeah, that makes sense. So I want to have the audience check out your website. It'll make sense when we're talking about this. It's glowmoderndental.com. That's correct, right?
Yeah, it's you can also do True Glow. We had to change in brand. Glow apparently was a different was some other product that came later. I didn't know, but I trademarked my True Glow Modern. So you can do True Glow Modern Dental or Glow Modern Dental. It'll pop up on the same screen, but you could tag it in the bio.
Yep. At some point, you decided to go all in on cosmetic, right? I mean, at least it appears that way. I think a consumer would see it as like, wow, this is really a cosmetic dentist, as opposed to a dentist offering cosmetic services. Is that accurate?
Yeah, that's what I love to do. I love to do the cosmetic aspect and the full mouth rehabilitation cases, like video, opening up video and doing full rehabilitation with implants and veneers, the whole shebang. That's primarily where I sit. But then I have my associates doing the bread and butter dentistry, or my
Yeah.
colleagues that will do them at the various locations. But
Yeah.
yeah,
That's
I targeted that audience.
what helped. What do you think is some of the most significant steps or actions that you took that helped you blow up this cosmetic business?
Oh, I think it's reaching out to the people that you've done the work on, even if you did like maybe let's say you're doing like one veneer set a week or even 2 weeks. I know that's like, oh, that's not a lot. I mean, people who are starting off, that's what they would do. They're not doing 5 veneer cases in a week or in a day. They're doing one every 2 weeks or whatever. And if you're liking that and you think you want to do that, or you want to do full crowns, whatever it is, and cosmetics is not, I don't just term them as veneers. Cosmetics is anything that even if you're doing an implant on the anterior in the anterior zone and if you're doing grafting or whatever it may be to enhance the aesthetics of the person, that would be cosmetic. Even internal bleaching is considered cosmetic. It's not just veneers. So cosmetics is when people come into your office, you're not just diagnosing back tooth cavities and doing all that. You're maybe seeing that their teeth are maybe a little crooked or maybe that they have irregularities in their smile, and then you're addressing that. So as opposed to someone who doesn't like to do that, they won't even mention it, right? So when you're doing your full comprehensive treatment, now start incorporating your aesthetics, right? So we have a systems in place for all our practices. We start, of course, first with occlusion, and then we check soft tissue. We also check for pathology, and then we do cavities and perio, and then we'll go into aesthetics at the end. But aesthetics is part of our comprehensive treatment. So at the end, we'll tell them to finish up all the cavities. You don't want to build the front when there's no support on the back of the house, right? Like you don't want to have a really nice front yard and then the back just looks
Sure.
destroyed, right? So
Right.
we definitely give that patient a full comprehensive outlook of their care. And then when we do these anterior treatments, when they're happy and they love it and all that, even like I said, when I'm going back to if you're doing one every 2 weeks, that one patient that really loved their aesthetic outcome, give them maybe something that a free guard or maybe a free dental cleaning or whatever it is, have them write you an incredible review with
Right.
photos and everything. And not only on one platform, make sure that they're writing it on Google, on Yelp. If you have a Facebook page, make sure they're doing that, and then document that. Then the next patient will come in from seeing that. Do the same thing with that patient. Once you build your rapport with the patient, but also your reputation in the community as having doing these beautiful aesthetic work, then you can maybe start dropping less and less of that stuff and going into and just kind of going into it. But you're gonna have to front load a lot more of the expense early on and the work that's going to be required to make yourself available to the public that you do this kind of work.
Yeah, that makes a ton of sense to me. Let me ask you this kind of interesting question. I think it's going to be interesting. At some point, you were a single provider, and then I'm assuming and guessing, and now you have 2 associates or 3 associates,
Yeah, I have
um,
4.
4 associates. Yep. So awesome. Congratulations on that. I mean, what is the difference in your mindset now that you have 3 or 4 associates
Mhm.
that are working on your team compared to being a solo provider? What does that look like? What does your life look like? What are the
My
comparisons?
goodness, my life,
Yeah. What does
it
everything
got
look
it got definitely more complicated, that's for sure. Because I feel like I'm like a people manager. Like I'm a human manager. Like because all day long I have to talk to a full range of staff, 34 employees. I have to make sure they're all happy, healthy, everyone is good and doing what they're supposed to doing. The doctors are well taken care of, that their schedules are fully booked, that they're actually producing and producing well, that they're not lagging and just being okay with getting a per diem. That I'm constantly looking at their development and improving them also as doctors myself, like not only improving myself, but making sure that they're taking CE courses and that they're improving their clinical skill sets so that they can be more efficient producers for the office. And that's where my mindset has more changed towards not only gearing in my own personal development. I find myself personally developing and helping other people develop their skills and their personal lives. So so it's a great thing to be a leader, but it takes a lot of stress on and you hold a lot of weight because you're wearing multiple hats.
Yeah.
I'm also a new mom. I have 2 babies at home that are under 2 years old. And
Congratulations.
so yeah, so it's I've been able to manage my time well because I delegate. And delegation is key.
Mm.
Delegation is key, but you got to make sure that who you're delegating to, they're actually going to do the work correctly. Otherwise, you're going to give yourself failure.
Yeah. Makes sense to me. I'm going to ask the last question. You've obviously grown this awesome business. What book or what mentor would you suggest that someone follow? Someone that's just starting out that has a young practice or still an associate looking to open a practice. What's
That
something
they
that they?
want us to, but honestly, they should pick up books that aren't only dental. There's the book that I just picked up. I'm going to actually bring it up. I'd recommend reading it's a New York Times bestseller. It's called Life 3.0 by Max. Okay, that book is amazing because it talks about artificial intelligence and how humans in this day and age are going to actually utilize it and in multiple facets. So
Yep.
we're using artificial intelligence, and this is if you want to go into business ownership, that you should read business books that are not just about for dental business.
Right.
um, you want to go into just understanding, pick up a book about S corps, C corps, LLCs, understand that corporation building and taxes, because taxes are very important for opening up a new business and seeing where
Right.
you're going to lead your expenses to reduce your tax liabilities in a legal way, right? And there is certainly ways that you could do that. That's one thing. You want to read marketing books, like Fred Joyle is a great book. Everything is Marketing. He was actually an old neighbor of mine. I was moving in and he handed me his book and I'm like, who is this guy? And I've read it, he signed it. I love him. He's amazing. He
Yep.
was like the founder of 1-800-Dentist, but he talks about marketing. These are great books. But the one where it's taking off right now is artificial intelligence.
Yeah.
Utilizing artificial intelligence also for marketing is going to be the way of life. You don't have to sit there and make a whole newsletter all by yourself by smacking on these pixelated pictures and it's not as streamlined, it's taking a lot of time, blah blah blah. You can use a lot of AI to you could use a lot of AI to do that,
Yeah.
to simulate that kind of those newsletter letters for you, and then even correspondences.
Yeah, and we'll post both of those book. The Fred Royal book is fantastic. Everything is marketing, and then Life 3.0 being human in the age of artificial intelligence. Yeah, so great books. I'm going to post them on our website and share them. Thanks for sharing that. I think that's great advice. That just the more books. Dr. Kalasho, I want to thank you for coming here again. The website is Glow Modern Dental or trueglowmoderndental.com,
Yep.
correct? Yep.
Work. Yeah.
Check it out. You've got some awesome stuff going on. Thanks for coming on and sharing with us.
Thank you so much. Thank you for having me. If anybody has any questions, they can reach out to me maybe on my Instagram at dr.rhondakalasho at dr.rhondakalasho. They can reach out to me there, and then I can shoot them my email at that point.
Awesome. Thank you so much.
Okay. Thank you. Thank you so much, Patrick.